Way-ah, hey-ah, way-oh, hey-ah, way-oh, hey-ah.
Scano, Sago, Saguli, Ani, Bojo, and good day. Lee Styres-Loft, Gyaso. My name is Lee Styres-Loft. I am a Cayugan woman of the Killdeer clan. I am the Aboriginal Patient Navigator. I am part of a team of health professionals at the Juravinski Cancer Center. My office is on the second floor in an area called supportive care. If you are Aboriginal and you have been told that you have cancer, I am here to offer support. Support for you, support for your family.
For everyone, including people from the Aboriginal community, coming to the Cancer Center for treatment can begin as a strange and confusing experience. When you first find out that you have cancer, I can speak with you on the phone or in person. I can also greet you when you arrive at the Juravinski Cancer Center. We could meet together at hospital, at a clinic, or another location in the community. Patients and family members have said to me, "It was such a relief to see you there, another Ongwe-Hongwe person like me. It was a comfort knowing that you worked at the cancer center. I had been feeling so afraid. But seeing you there, waiting for me at the front doors, made me feel like everything was going to be okay." You might feel afraid or uncertain about cancer. You may feel overloaded with information that may not be easy to understand. You might want me to come with you to clinic visits and be a second set of ears when you are speaking with doctors and nurses. At the Juravinski Cancer Center, we understand that each person's experience with cancer is unique. We can talk about what your first visit to the Juravinski Cancer Center might be like. This means that we do our very best to be sensitive to your individual needs. I am here to help with any emotional, physical, mental, spiritual, social, or cultural needs you may have. I can also arrange for cultural translation services or help connect you with traditional Aboriginal healers. I can share information with you about the many health services available here at the Juravinski Cancer Center. I can also let you know about community organizations such as Deidwada Desne Aboriginal Health Center and the Ganiyos Health Center, as well as Six Nations health services such as the Family Health Team and the New Directions Group Patient Advocates. Storytelling is an important part of Aboriginal culture. We all have sacred stories. Our stories are traditional ways of teaching and supporting. Talking about our experiences can help make things more clear for ourselves and for others. Many people have spoken to me about their experiences. The following story puts several of these experiences together. Let's call this the story of Grace. Grace met with me when she first came to the Juravinski Cancer Center. At that time, she felt that she had all the support she needed. A few weeks later, Grace telephoned me. She was very troubled. Grace told me that she was faced with a difficult decision. She did not know whether to have chemotherapy treatments or not. Chemotherapy is one form of treatment used at the cancer center. Chemotherapy uses special drugs to attack and destroy cancer cells. Grace felt torn between her cultural teachings and what she was being told by doctors. When she thought about chemotherapy, she thought about her family. Some of her family had told her, "Chemo is not ours." She also heard some people from her culture call chemotherapy a harsh poison. But she also heard the voices of her adult children. They encouraged her by saying, "You need to do all you can, Mom." After listening to many opinions, she knew it was her decision to make. Grace decided to go ahead with her treatment. She told me that she wanted to try everything available to regain her health, for her own and for her children's sake. When she started chemotherapy, Grace admitted she was nervous. She told me that the Haudenosaunee Good Mind teachings helped to calm her. She practiced being positive and hopeful. She surrounded herself with family and friends who could support her decision. She also focused on only one treatment at a time. Grace said she appreciated the way we had discussed chemotherapy as being a really strong and aggressive medicine. She also talked of the kindness of her healthcare team, especially the chemotherapy nurses. Grace appreciated their support and understanding. Referring to the Juravinsky Cancer Center, Grace said, "I now have another healing place." Choosing what to do when you have cancer requires a lot of thought and courage. I am here to listen. I am here to support you, whatever you decide to do.
If you or a member of your family is Aboriginal, or you feel you have a connection to an Aboriginal community, you can contact me by calling the Juravinsky Cancer Center, or by asking your nurse or doctor for a referral to the Aboriginal Patient Navigator. If you choose, I look forward to meeting with you. It would be an honor to walk with you and support you on your healing journey. Nyawa Megwech. Merci. Thank you. Donato.
Yahweh,